Hello, everybody in Bangalore or virtually Bangalore at the IEEE 5G conference. And this is the health tech session. So I'm reporting to you about some ideas of how to use 5G and other technologies as a way to achieve healthcare democratization. My name is Michaelfriebe. I'm a professor for health tech innovation at a university in Germany. I'm also reporting right now from my garden in Germany, quite nice weather. So next to being in Bangalore, that's the second best place you could be at the moment. So let me start with some of the things I want to talk about. In general, I want to talk about some of the ideas that are actually called innovation in healthcare. They are mainly incrementals. So you make things a little bit better, but it still is using old approaches, old processes, and tries to actually improve them a little bit rather than being more disruptive. And disruption is needed in certain areas in the world. This real disruption that I want to talk about is very often aggressively prevented from the stakeholders because they don't like the ideas of actually taking the human to a certain extent out. There are established processes around. And you also need to have regulatory approvals that you have to jump over. And you have to fight if you come up with new ideas with the established and existing reimbursement models. And so it's very, very difficult to actually get into this market segment with new ideas. The exponential technologies that I want to talk about and that I want to use as a concept, I want to not only think about making things dramatically better, but I particularly want to talk about making existing things dramatically easier and cheaper. And I think this is the key concept. Believe it or not, it's not the technology improvement necessarily, but it's actually making devices and processes available to everyone and available at a relatively low cost. And that's when you achieve democratization of healthcare. So COVID-19, we are in this crisis at the moment, has already boosted a couple of the applications that are done using, for example, 5G technologies, applications where you don't see a patient doctor directly anymore, but you actually meet doctors or apply medical procedures or monitoring applications via a computer link, via a communications link. And globally, that has been a massive positive impact, COVID-19, as negative as it is, but at least to digitization of healthcare, that was massive. So one more time, this is not a technology presentation, so I don't want to disappoint you, but if you expect some formula, some electric circuit drawings or some other highly technology stuff, you will be disappointed. I hope you will be excited, however, if you listen to the end about maybe a different thinking process and maybe something where you can apply your technology knowledge on a much broader aspect and solving challenges that may affect you in the future as well. So it's in general, let's talk about innovation challenges within the healthcare segment and also about disruptions. And I want to particularly emphasize my personal, I call it the MTP, a massive transformative purpose. You see it up here in the header of this presentation file. I call myself a health democratization enabler. It's maybe very how would I say this? Maybe high stake goals, but what I put my life and my efforts under is to make people aware of what they can do to provide tools and devices and processes for everybody on this earth and this planet, rather than only developing items, devices for the developed world that are very high pricey and that are, again, not available to everyone. So this is my personal goal, and I hope that you'll be a little bit excited about approaches and maybe also become a fan of it and maybe work in this segment as well. I also want to show you some opportunities that come with it. I have one example also that we actually trying to get done together with the IIT in Kharagpur. And it's like a mobile concept. It combines a lot of technologies with telecommunications, so very high-speed communications, I think, because they're necessary. And provide services for urban areas rather than always improving or continuously only improving the segments that are somewhat well already. So a little bit starting over with what healthcare is actually, what the state of healthcare is. So currently, and you may have heard that before, we are dealing actually, with not with healthcare, but rather with sick care. You go to the doctor when you're sick. The health insurance pays when you're sick. Actually, unfortunately, the life insurance pays when you die. So there's no positive effects, and it's all to a certain extent negative. You only think about health or healthcare traumatically when you have to pay and when you're sick, rather than the healthcare system or thinking about maintaining your health and preventing you from getting sick. There's a lot of money involved in that system, and that is typically something that is not well paid, keeping you away from the doctor, keeping you away from the hospital, staying at home, maybe doing some things at home, being able to actually, analyze your own physical state, and then decide on whether it's really necessary to go to the doctor or not to see a human. I'm not trying to get the human out of the game, but I'm trying to actually make healthcare available for everyone and make it not a process where you have to think about on whether you can afford it or not. So this is a very important aspect, because a lot of people actually get sick because they don't go to the doctor at the right time, because they just simply cannot afford it and they cannot stay away from work or other things. COVID-19 is a prime example of what the effects could be on this one. So we need to work a little bit more on prevention in the future. And we have to move to an approach where we apply precision medicine, so where we use whatever is available to actually determine the state of your disease, of your health problem. Maybe even look beforehand using precision medicine to actually see whether something could develop. We need to put the patient in the center of medicine, not you moving around in the system to going from there to there to there. Data access is complicated, data accumulation is complicated, and so these are some of the things that will happen in the future, and we will need to get to. And 5G and other exponential technologies are a key concept and a key need for that. So we need to shift the delivery of the health, possibly not anymore at the doctor's practice or the hospital, but possibly to a certain extent, you can do, or you will do your assessment, your health assessment at home. And with that, there will be different business and innovation models coming. And very often that's not looked at. You look just at an individual component, but rather look at what will the effect be on the entire healthcare setup, system, reimbursement, business. So cost, I think I put this as the last one down, I will mention that several times, is a major concern. I'm talking from a Central European company, with one of the best healthcare systems in the world, and I'm reporting from a very high level. But we complain about our own system as well. Our system is also getting more and more expensive, and it gets more expensive because we always think about these incremental innovations, about these little things that add a little bit of added quality, but cost significant amounts of money. Different problems you have in more developing nations. I'm not saying that India is a necessarily developing nation. To a certain extent it is, and probably in healthcare, there's at least this huge divide between urban and rural areas. You need to make sure that healthcare stays affordable and everyone in the country can actually participate in getting a good solution for their own health assessment. And that is cost is a prime determinant for making sure that that will happen. So quick one on COVID. I am dealing with telemedicine, and I'll discuss a little bit what that means in general. For the last 20 years. In Germany, for example, it was not even allowed till about a couple of years ago to use this as part of the normal healthcare diagnostic services, and it was not reimbursed. Now, a lot of people, even up to last year, said it's a long time ago before something like that will happen, and then we were hit by COVID-19. And interesting, what happens even in the U.S., they were now actually proposing to rather use a virtual doctor's visit rather than to go to see the doctor in person, make other patients maybe sick. And while I'm not necessarily agreeing with these three people and this government in general, I think they have actually the digitization and the telemedicine approach has dramatically gained attraction in the last few months. And there's a little chart on this one. This is very interesting. Basically, on the left, it started with COVID, and it ends up in the middle of April. And the actual face-to-face visits in doctor's practices went significantly downward. At the same time, the communication or consultations via tele approaches went dramatically up, and it actually has stayed that way. Now, there's a lot of other issues with that because people don't go to the doctor because they're afraid to get actually sick, or they can actually get the virus while going to the doctor. So there's a lot of delays in there, and that is actually negative. But in general, you see the tendency in that, and I believe that will stay that way. So the pandemic has actually caused a significant expansion of telemedical approaches. Now, you also see this when you look at some of the companies that offer telemedical, telehealth solutions, telepharmaceutical solutions. Their market capitalization, their value basically of their company has risen dramatically just in the last 3 months, from in average 100-200%. And they are on continue to go up. There's a lot of other approaches that have gained not only attention, but have actually been quickly implemented using certain services that can now be used on a virtual connection, or maybe with sensoric at home. And I have some examples on this one later on too. So another quick one, just to give you also an idea of what generally people spend money on. 90% is actually spent on housing, health, food, and other things. And the COVID-19 has opened, and I highlighted this one, has opened floodgates to innovate significantly faster and quicker with respect to digital applications. So as sad as it is with this COVID-19, there's all the benefit, the drawbacks it had in the recent month, and possibly will have in the future to come. It has done more to digitize self and healthcare digitization than any initiative in the last 5 years. And, interesting enough, at a very, very high speed. There was a high need behind it, and that's actually something that I think is very important. Anyway, in healthcare, you need to identify a very, very high need, and then people will actually act on it. So COVID, with all the negative effects, was very positive for the digitization efforts of healthcare. However, what is reality? Telemedicine requires computers, requires communication links, requires actually software, requires time. And particularly small practices and smaller providers do not have the means. The people on the other hand, the patients don't have the means. There is not a common standard around, and so there is a lot of difficulties of getting these things implemented. So what is it? What's the reality look like in Germany? It's very interesting. I just want to provide a quick example from my own experience. It was the last 2 months. I had a little problem with my heel spawn orthopedics. I went to the orthopedic doctor. He gave me a manual, basically a written referral to go to the radiologist. Of course, he didn't tell me which radiologist to go to. It's my own decision. So I had to call around. You cannot do any bookings online. It's not digital at all. Well, once I was able to actually get an appointment, I went there. Procedure was done within 15 minutes using a very, very high end MRI system, very cool, new system, 10 minutes, thing was done. What do I get? A paper printout of my heel. And that's kind of like the diagnostics they use, the doctor as well. What was very interesting is that I got a report as well within 5 minutes of finishing my procedure. But what was it? It was a handwritten document. So far, far, far away from any digitization. That's Central Europe. This is Germany. And then I got a CD-ROM. You know what? I don't even have a CD-ROM drive anymore. So very, very interesting that these these digital systems are actually always analog. There are so many analog components in there that it will make it really, really difficult to actually move over to a digital system and taking advantage of all the data components that we have. Most of the communication in Central Europe, and I assume that's the same in many other countries, is done by fax. I honestly don't have a fax system anymore either. So maybe the doctor can communicate with the doctor, but the communication to the patient is rather limited. So think about also from an innovation perspective, think about the error potential, the workflow, possible workflow improvements, diagnostic improvement, time, money saving opportunities that you just see on this one screen here. And I hope that there will be dramatic and fast efforts to get that done. But there's a lot of hurdles in there and a lot of people who are risk averse and are innovation averse and don't like this to happen in the next few years. So some of the learning goals on top of it, you need to understand that there is not, telemedicine is one way, and it's mainly the communication between two people using telecommunications links in between them. Telehealth is a completely different aspect where you actually use digital tools on either end that are used at home, for example, monitoring, measuring, taking advantage of the digital information that you can have, and then lead to what we call an interconnected health system, where you can use the data acquired in combination with artificial intelligence and machine learning approaches to eventually reach a point that we call digital health. Digital health still has people involved, but it will actually be something where the questions that a doctor can ask with respect to diagnosis are integrated. The sensorics, the measurement tools are actually going beyond what the normal doctor would normally do, also include devices and systems that don't typically follow all the senses that a doctor would use, touching, feeling. Maybe they use audio approaches, they use signal processing and many other things that will lead to dramatically more and better information that are also personalized to you and to your baseline. We will get, and that's not a learning goal, but that's something that I'm firmly believing, we'll go to a patient center and an empowered patient, where the patient, him or herself, will determine when to actually go into professional care and when not, and actually have systems and tools available at home to determine their own health. And a lot of these technologies will be so cheap and so widely available, they will be abundant, so that they will hopefully lead to some form of health democratization. So everybody in this world, everybody has a cell phone, and most people have a smartphone. This smartphone can actually be the connector to digital health approaches and to sensoric applications. You can theoretically think about all kinds of sensors that you can put on. You measure your auscultation, your flow, you can measure ECGs, maybe an SpO2 measurement. All these data points to a certain extent are individually available, but not in summary. So there's a lot of opportunities involved, and there's a lot of opportunities for everyone on this planet involved. Healthcare is global, as we all know. So I also want to teach you or tell you about this a word that I think it was started in the US at Harvard Medical School, something called reverse innovation. Just a quick definition of reverse innovation. It's where we actually develop not necessarily something in the developed world, in Germany, for example, for Germany, but we develop something in Germany for India. Because we don't have a market in Germany, we don't have stakeholder approval, we don't have support from the government. But in India, there's a completely different need where they have approval, they have the need, they need to connect the patients to the doctor. They may not have enough doctors, they may have completely different reimbursement systems, and they will actually use it there, prove a point, show that it works and is very efficient, and then it comes back to developed world. Basically saying, hey, Germany, by the way, it worked very well in India. Why should it not work in our country, even though there's a lot of people who are against it? So I think most of the things I've talked already about it are just listed here, so you have it at least when you watch it, some of the definitions. But we will need to not only have telemedicine, and I think that was clear. We need to use the possibilities that we'll have with machine learning, artificial intelligence, robotics, sensorics, even blockchains. We have to use this to actually get to a point where we talk about telehealth and digital health and a patient-centric health, which is which also has data points that it uses from your home care, your home approach, and in the professional care, and merges them together. And with all these data points, we should then be able to actually get much better information on disease patterns, how they develop, maybe early stage information. So just also a quick one on, I found this was very interesting, on what in the last few months, frontline providers and primary care physicians have actually used telehealth application. The telehealth is in this case wrong, it's more like a telemedical application, but they have used in their real practice. And it's very interesting to see what the cases are. And you'll also see that while it is to a certain extent also COVID-19 urgent case, it has something to do with routine and follow-ups, and also particularly in the primary care physicians has to a large extent to do with normal medical application. There's a lot of things that are not included in this one, is like taking data points from home, maybe actually doing things at home, maybe also some educational issues. And a lot of these devices or things that I have said about telehealth, they're not only going to the direct interface between patient and doctor, they are actually also dealing with data management, they're dealing with emergency case situations, with rehabs, with pharmaceutical, also with wellness. Wellness is a very important thing. I'll get to this in a second. So connecting all these points, and as you see here on this right side, the patient should be in the center. The patient should be in control of his or her data, rather than somewhere in the healthcare system, somebody collecting it. The patient needs to be the one who is able to actually pull all this data and allow everybody to get access to the data points. So again, mentioned this. Now let me just go back quick one. This is at the bottom of my heart. What is the innovation process for digital health? So, and it's not only the digital health; it's actually innovation process for general device innovation or process innovation, clinical innovation that you think of from the technical field or an interdisciplinary setup. We need to have a clear understanding of the healthcare problem, but also with the foresight, what will happen using these technologies in the future. And then we will actually try to, once we understand the problem properly, also understand the economics behind the problem, then we need to find solutions or try to ideate solutions that we then need to validate and check towards reality, and maybe also check in different countries, so we know that it works in one place, maybe while it does not work in another one. So this is what I really love to do, is to talk about innovation generation. I can tell you already that it's significantly more important. I have a slide on this at the end, to understand the problem, to understand the challenges, the needs that come with it, and also the economics behind it. And it's more important to know that than to be a AI geek or robotics geek. You need to have this knowledge, but you can actually get this information, get this knowledge when you know that it's really needed and what is needed. But you need to understand the entire picture to create health tech or healthcare innovation by being a little bit more first superficial, focusing on the problem, and then actually trying to work on the solutions stage. So in the future, we'll have a quadruple aim of healthcare, things that we need to consider. Everything you do in healthcare, you should actually ask these 4 questions. Does it reduce cost? Very important. Does it improve the outcome? But even if it doesn't improve the outcome and stays the same and it dramatically reduces cost, it would be good. Does it improve the clinical and patient experience? Very important. Please check, not only does it make things faster, more beautiful, more easy, but does it solve some of these issues with healthcare? And please also consider, and I think that's a very important chart that I found, where will healthcare be delivered? Will it be done at the clinical practice of the hospital, or will it be done anywhere at a home? And this is a chart that I found with a prediction what will happen in the next 10 years. And I actually believe that will happen faster than in 10 years. So doctor will be only 2% where healthcare will be delivered. And that's a little bit the reason why there will be a later stage where you will do a lot of things at home. And once you find it out that something is wrong, or the machine algorithm tells you, or a comparison to your peer level tells you, then you will actually go into professional care. So there's a lot of issues with that, and there's a lot of stakeholders involved in healthcare, and that makes the whole thing very, very complicated. So some of the 5G issues, I put down decreased latency. So we need to really have that, because a lot of the connections to rural area healthcare will be done using mobile networks. And without 5G, you will not be able to actually offer advanced services in these places. We need to reduce manual executions as much as possible, because the human is the highest reason for errors in this clinical field. And we need to obviously have availability of data that connects everybody to the global healthcare data world, analytics, all the other stuff. On the right side, governments are involved, citizens are involved. Governments want to be elected. There's political things in there. Healthcare is a big issue. We have healthcare organizations, we have research entities, we have the individual healthcare providers like doctors, hospitals, etc. So there's a lot of people, and they have all different interests. And this is one of the most complicated things in the getting actually healthcare innovation out, is getting an approval agreement with a majority of these stakeholders. So if you want to have benefits for everybody in this healthcare, benefits would be here on you see on the left side: better health outcome, faster cures, economic growth. You need to make sure that you actually provide transparent, ethically approved, secure connection, secure data acquisition, and algorithmical approaches that then are accepted by all these stakeholders in the system. And we need to not only look at the conventional data that are typically used in healthcare, is like acquiring health data by listening, by having diagnostic equipment systems out there, but also taking into consideration behavior patterns, biology, genetic information, and other. And we need to train and educate everybody involved, and this is a little different level. That brings me also to a point: what is actually a determinant of health? Health and longevity. You want to all live long, right? And if you want to live long, you have to maintain a good health. So what is actually a determinant for your good health? Now, understanding that is what I mentioned before: healthcare by any means is not very agile. It is at the bottom of agility. And so we need to really prove a point, and possibly the patient or the payer, which is the patient as well, is the only one who can actually make change happen faster in this setup. So determinants, I just mentioned them. Socioeconomic effects: how well are you educated? What kind of family you live? Are you rich or poor? Rich people have a significant higher life expectancy, as you see here. So that could be 10, 15 years, depending on where you live in the top 10%, bottom 10%. Making this a little bit more equal would also help. Genetics and biology at 20%. So sometimes you can, not sometimes, you can never actually pick your parents. So some of the things are just inherited. But knowing about all the efforts and all the things that happen in genetical engineering, you can believe that maybe some of the problems could be solved as well in the future. Of course, if you live quite unhealthy, you don't eat well, you drink a lot of alcohol, maybe use drugs, you smoke, you don't exercise, that's not very good for you, and has a very negative effect on your health and also on your longevity. Where do you live? Are you living in a city? Are you living in the countryside? Is the air bad? Is the water bad? Also has a 10% effect. And only 15% actually depends on the healthcare provision. But we spend so much money and time and effort dealing with the last part, which only makes 15%. And we only get there when we're sick. Again, that's what I mentioned before. We need to work on these other issues before, and maybe it makes a lot more sense to actually invest some of the money that we typically spend on healthcare provision on actually making you healthier. So just a little chart here on this one. I don't want to go into detail on this one, but all the ones on the left side, all the risk behaviors, they are depending on you patient, and they will cause these diseases that are in the middle. So if you are reducing the part on the left, you will have a good chance to actually not get the diseases mentioned in the middle. And you can see this also when you look at the so-called health adjusted life expectancy. The numbers are really lower here. Please look at the green arrow going up, where there's Thailand, Mexico, Brazil, and also India. That's the big one in the middle, compared to the rich countries that are following this gray arrow, where there is, if you look at the UK, for example, in the US, there is a 3 years a lower health adjusted life expectancy in the US versus the UK, while at the same time the UK's healthcare cost is 2.5 times lower than the US. And so some of the drivers that actually make that happen is the inequality. If you have a lot of money in the US, you will have a good life expectancy. If you don't have a lot of money, you'll pretty much at the bottom. And there's so many costs involved, and the costs are so dramatically higher that is a major issue. So we need to We need to deal with this, and hopefully we'll get this done in the next few years. So some of the things where you can benefit and where it can actually can make your life expectancy longer is obviously don't get sick, hang out with a lot of women. That seems to be a good thing. Also be married seems to be good. Eat healthy. So those are some of the things we need to educate people about. And nothing to do with technology again. So be a happy married outdoor guy seems to be a fairly good recipe to live long. So what will happen, I mentioned some of these things before. Telemedicine will happen. We will have precision personalized medicine. We'll have probably a lot of wearables. We'll have a lot of demographic change with a lack of experts and staff. So that's a major problem. We'll have at the same time, while we have these new technologies come, we have less people, less humans actually available, and we need more people at the same time. So we need to maybe gap the lack of people with technologies that we have available. So some applications that could be very good for 5G in the patient, in the hospital, and the medical management setup. Don't want to go in detail on this one. You can read it and you may actually know it yourself. And 5G could also be used, or technologies like that, to actually deliver medication, make emergency services available to urban areas using copters or using these kind of approaches, but that also requires fast connections and requires remote services with a lower latency. So we'll need to have a home care wearable platform combined with the outside medical services. Need to interchange ideas, they need to interchange data points. This is something that will hopefully help then to create democratization. And we'll have robotic surgery. That's always an example that is very often used. You know, you don't have the experts in the rural areas, but you have the robot maybe there, and maybe somebody else will use it. Well, there's a lot of things that can only be solved by technologies like 5G. Okay, quick example, and then I'm done. So we have we've proposed a prevention tomography device on a mobile access, and a problem was that a lot of the doctors in the rural areas are not available. We have a lack of proper diagnosis. We have large distances to go. People cannot go. They don't have the money available for it. So we propose a mobile solution that actually contains a robot, contains diagnostic equipment, contains equipment that allows you to actually use to do blood samples, microscope, and there's only one person there, and there's a lot of data points that will then be able to analyze the state of people very quickly in remote areas and will hopefully help to democratize